The 25th day of June 2024. I am George Wenner, and I am here outside of the Ministry of Health, where nurses in Antigua and Barbuda are taking industrial action. Where, Mr. Malwin, if we're outside, something is wrong inside. That's one of the messages. And the nurses are here. They're protesting. Another sign. Put back the piano pan the Midwifery Board. Okay. So I'm gonna try to reach to the person in charge. Who is gonna speak with me this morning here? Who is the person? Miss Williams. Sister Williams. Sister Williams. And so healthcare outside. So Marlon now heading for nursing. Sister Williams. So if you can come on this side for me there, please.
Okay, good.
Yes, Sister Williams. Yeah, Sister, right there is good, right there is good. Sister Williams, this way, you can look this way, yes. What is some of the concerns for the nurses? What brings the nurses out this morning?
Well, good morning. Well, it's a long story.
Mm-hmm.
So I need to start the story.
Yes,
It's not just saying something, but it's saying the story.
yes.
Recently, the Minister of Health has single-handedly selected the board, Midwifery Board, and he has removed the chief nurse, the principal nursing officer, from off the board without any consultation, not even informing the principal nursing officer. Now, you have to understand, sir, that the laws of Antigua, in terms of the midwifery laws, they were put in place since 1950. They were old. Mm-hmm. And so when the P&O position became available in the Ministry of Health, some 45 plus years ago, the laws did not speak to a chief nurse, somebody to manage nursing, education, practice, and regulation. And so Dr. Mulrain, in his wisdom as the CMO at that time, he made a decision.
Dr. Mulrain.
Mulrain.
Yes.
Yes. Carlos Mulrain. He made a decision that the P&O needs to be on the board to regulate nursing. The P&O is the highest nursing office in Antigua, the highest position.
So the principal nursing officer, help me understand this.
Yes.
The principal nursing officer would be comparable or equivalent to
The CMO in the
the
Ministry of
chief
Health.
medical
Officer
officer.
in the Ministry of
And whereas the principal nursing officer see to the nurses,
Yeah.
the chief medical officer see to the doctors.
And other things related to health.
Okay, so they are
Yeah.
comparable.
Yes, because she's doing the issues.
She or he?
She or he.
Yes,
It's an
yes.
office.
Yes, yes.
Yeah. And then, how many years ago the P&O, as I said, was not included because there was not an office.
Yes.
And so when the office was put together, they recognized it. In order for the regulation to take place, that the P&O must sit on the board, the head of nursing, to help to regulate nursing. And a cabinet decision over 40 plus years ago placed her on the board. In the law did not have her. Placed her on the board as a registrar secretary. Now this
For the board of nurse, board of midwifery.
Yeah. Now this registrar is not a secretary that takes notes.
Uh-huh.
She looks about persons eligible to be put on the register, their qualification, whether in Antigua or wherever they come from, you apply to be a midwife. She looks at the condition under which midwives are trained, and she is the one basically, when they end of the program, issue an examination to prove. So it's not an ordinary secretary. And the minister, I don't know what prompted his decision, but we have an idea of what it is. Decided to take her off the board without even saying anything to the
So
P&O.
to remove the principal nursing officer,
Yeah.
in some territories it's referred to as the chief nursing officer.
Some people is the chief, but
But in our territory, the
yes,
principal
most of the
nursing
time,
officer,
we say
from
principal.
off of the board without
Yeah.
any consultation
Consultation.
with the nursing association,
or
no one,
even the P&O who sits in the ministry.
just
Yes, you
just
have to
kicked off the
understand
board.
that anything to do with the regulation of nurses come through the ministry to the P&O.
The principal nursing
Yes,
officer.
the P&O.
Yes.
Just recently, the ICF, the International Council of Midwifery, says that the curriculum for nursing in Antigua must be upgraded. The
Yes.
message came to the P&O. She was the one who had to put a group together to review the curriculum and so forth. That is the function of the P&O.
And so we have, in your opinion, the minister is overreaching
Yes.
into nursing and the administration of nursing.
And how it is supposed to be regulated, hasn't inserted himself, and he actually put the board together himself.
without any consultation
He puts
with
the board
the
together.
nursing
And I also
association.
blame the PS in the ministry because she is the one who is supposed to implement. The PS makes policy,
The permanent
minister
secretary.
makes the policy, and the permanent secretary
Info-
implements as the head of the ministry.
and manages
and
the
we
ministry.
are seeing that the PS is leaving the minister. I don't know for what reason to do all he has to do. And we are saying no to Mr. Minister. We are saying no, put the minister, the principal nursing officer, back on the board so she can regulate midwifery in this country. That is what we're asking. All the thing we're asking, she is the head. So how can you be regulating midwifery without the head?
Who comprises the board at this time as constituted by Minister Joseph?
Well, the only thing that I know, we had a meeting with him. He told us he had 5 persons. He never named anyone.
So they were never identified.
But I know that the law says that the CMO in the Ministry of Health is the chairman. So that much I can tell you, that the chairman is usually
the chief medical officer.
Yes, is the chairman. Just like the PNO is the secretary register. So we don't know because he has never sent any communication in spite of us asking him in a meeting.
I understand that you have reached out to the minister weeks ago, and you have written to him, but you're yet to receive a reply. This is what I'm hearing.
Well,
is that correct?
I got a reply from him last. In him that we are not acknowledging the board as constituted at this time, and that he must fix it. And the fixing is put the midwifery, the PNO, back on the board so she can effectively regulate midwifery. She is the head of nursing and midwifery in this country, the highest position, and it is an insult to the profession of nursing. And we are not going to sit back and allow the minister to single-handedly put a board in place to get what he wants. We are an autonomous body, and the minister must listen. He must listen.
Yes. Okay, so there you have it, folks. Thank you, Matron Williams.
No, I'm the president of the association.
Sorry. The president of the association, Nurse Williams. Yes, the president of the Nursing Association. Oh, that's the principal nursing officer, the lady. What's her name, may I ask?
She's Margaret Smith, but it's not the name. It's the
Yes,
office.
I understand. I will see if Miss Smith will want to have a few words with us.
That we are alluding to.
Good morning, Miss Smith.
Yeah.
Good morning. George Wenner here, realnewsantigua.com. And we understand that there's a situation where the principal nursing office that you hold, Nurse Smith, was removed from the Midwifery Board. And we just heard from Nurse Williams. You have anything to say to us in that regard?
I'm not going to comment on the specific issue
Yes.
at hand because of my role in the Ministry of Health. What I will say to you that the Nurses Association has 2 main pillars in which they apply their role and responsibilities. And one of those pillars is to ensure the health and well-being of nurses in Antigua and Barbuda. And they also have a responsibility to advocate for the safety and the health of the general public. To that extent, what they're doing today, if it is in pursuit of those objectives, then I think it's a good thing, and I applaud them for that. I cannot comment on the comment at hand because of what I just explained to you, but I have a statement that I'd like to share with you, and I will give that to you.
Please go right ahead.
Thank you. Here you go.
Oh, I thought you were going to read a statement.
No, I'm going to give you that statement.
You're going to give me the statement.
Yes, and then you can...
Okay, we'll disseminate.
Thank you very much.
Okay, we're doing a live here. And there you have it, the principal nursing officer, along with the president of the Nurses Association. What's the complement of your association? How many nurses?
We have roughly 293 members.
293
we
members.
also take care of the community health aides.
Yes.
So we have different levels of membership.
Yes.
Yes.
Okay, so there you have it, folks. The nurses, they're just taking a little respite on the eastern side by the post office. This is what is happening here. And so the nurses are all here. And you can see some of the slogans that are here. And so the principal nursing officer is now addressing some of the nurses. And so one of the signs reads, "It's not personal, it's professional. Respect the principal nursing officer." And so the nursing officer, she just gave an address to the nurses, and they're all here. They're all here. Sir Malwin, if we're outside, something is wrong on the inside. Nursing is an autonomous profession. Stay in your lane. Wow, that's one of the slogans. Take your knee off the neck of nursing. So there you have it. The nurses are really expressing how they feel about this situation and how they're being treated, and how the principal nursing officer in some territories is referred to as the chief nursing officer, how they're treated. So there you have it. The system, there's another slogan. It says, the system is broken, help. So there you have it, with officers from the police force keeping the peace, the nurses, they're doing their rounds outside of the Ministry of Health here in St. John's on Lower High Street, and the nurses are taking a stand today. So there you have it, George Wenner, holding their feet to the fire, keeping them honest.